Is there better relief from the scorching summer heat than splashing around in a pool? While the water may feel great on the skin, it may cause painful ear infections. Please join TGMC for advice on how to avoid the annoying and painful swimmer's ear this summer.
All right, welcome back to the To Your Health segment with Terrebonne General Medical Center, and it's the summer months and everybody's out there swimming, and here to talk about a very important issue that affects everyone who goes out in the pool and in the water. That is swimmer's ear, is Dr. Irving Blatt, and he is an ENT, and he's here to join us. And welcome back to the program, Doc.
Thank you, sir.
Yes, sir. Let's get started off. What actually is swimmer's ear?
Swimmer's ear is an infection of the outer ear canal.
Okay.
And if you look at the graphic, you can see that in the inner part of the ear canal is made of bone. You can see the bone come down, and then the outer part is kind of an orange, but it's one ear canal, and that's made of cartilage. And the cartilage part allows the ear to be moved around and around. And the issue here is that that is the area that becomes infected in a combination of germs and water in the ears that's related to swimming.
Okay, so it's the outside of the ear. I got you. What causes the swimmer's ear?
A swimmer's ear is caused by a combination of water and germs.
Okay.
And the germs can be a fungus, but primarily it's a bug. It's called a bacteria. Okay. And one of the most frequent is a germ that actually can be identified by the naked eye because it has a greenish, sometimes bluish, sometimes a brownish color.
Oh.
And that germ is called Pseudomonas, Pseudomonas. Actually, some of it lives in the ear canal.
Okay.
And the ear canal is not that acid, and it's usually dry. But if you get the ear canal wet, then you're dealing with the opportunity for this ear canal skin to become infected. Okay. Ear canal skin is not like skin of the forearm that you can move. It's tightly round skin that's tightly attached to cartilage and bone. So that when this skin becomes inflamed, it creates pain because the pain receptors are stimulated because the ear canal skin swells. Okay. And you get ear. And not only do you have pain from the ear canal itself, but the ear canal is absolutely right behind the jaw joint, and so you have to swallow. You have to open and close your mouth. So if your canal skin is swollen and you open and close your mouth, you have pain in the ear, but not in the joint.
Okay, very, very interesting. What are some types of symptoms that you can be aware of to know if you have swimmer's ear?
Usually the first symptom is itching.
Okay.
And then from itching, you have a sensation of heaviness in the ear and beginning swelling. And the itching is such that the child or the adult wants to put the finger in the ear to scratch it, or a Q-tip. And when you do that, the skin is already macerated or injured by the water, and what you're doing is you're rubbing the germ into the ear, so you're actually inoculating the ear. You're giving yourself your own infection. Okay. Now, so the individual may use peroxide in the ear, and that's dangerous because peroxide feeds the germs, and also if it's in pure concentrated form, it can actually burn the skin. So you don't want to produce peroxide. You don't want to use alcohol at home either, because the alcohol will dry the skin. And we'll go into it later as to how you can prevent this.
Okay, all right. Let's take a short break, and we'll come back and we'll discuss about how to prevent it and how to treat swimmer's ear as well. So we'll take a short break. More with To Your Health with Terrebonne General Medical Center.
Put together a crew of top specialists, and you can do amazing things. Cardiac care at TGMC. It all begins here.
I'm a director here at the Little Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Schilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
All right, welcome back to Your Health with Terrebonne General Medical Center. We're talking about swimmer's ear with Dr. Irving Blatt and an EMT, and he's kind of showed us thus far the causes of swimmer's ear, the types of symptoms you can have. Now we want to talk about how do you treat swimmer's ear once you have this problem.
If it gets to the point where there is pain and there is swelling and the individual really is looking for medical help, as a specialist in my field, I am suggesting that the primary care for the treatment of ear infection is the ear, nose, and throat doctor.
Okay.
The ear, nose, and throat doctor is equipped by training, and is also equipped by technique and so on and so forth. Usually they'll examine the ears. We'll examine the ear either with an otoscope or sometimes under the operating microscope. We will find that the ear is swollen. In order to treat the ear, if there's a lot of swelling, and this germ has set up housekeeping in the ear canal, even though the ear canal is swollen, you need to clean that out. Because if you put eardrops and you need to locally treat this, the slough of the process that this germ creates needs to be removed. So we make our own Q-tips. We go ahead and we put a piece of cotton on a cotton carrier, or what we call a Q-tip, and we just go in there and we lie the patient down and we clean it. And if it hurts, we apologize to the patient, saying, now look, we've got to clean this.
Okay.
Now, once we've cleaned it out, you can go ahead and use a little bit of a medicine, like a little bit of cortisone and alcohol, to help dry it and further clean it. And then once you've done that, you want to put drops in the ear. So you go ahead and you wind this little cotton carrier, little Q-tip, and then you take it off. And we're going to put a wick in the ear. And the wick in the ear is staying in the ear canal that the doctor inserts, because it keeps the medicine from flowing out, okay? So we'll take our little wick and we'll put it here and we'll stick it in the ear canal. Okay? And so here you've got the wick in the ear.
Now
it stays in about 4 or 5 days.
Okay.
And the patient, the mother or the patient puts 5 drops. I prefer 5 drops in the ear 3 times a day. In addition to that, we give them oral antibiotics. We may even give them some injectable antibiotics as well as steroids.
All right.
For a few days. Usually this will clear up within a few days. I'd say 95% of them will clear up.
Okay. But what you just showed, that's something that the ENT should do.
That is something that the ear, nose, and throat doctor does, at least I would like to think everywhere.
Right.
And I know that we do, ENT members of the medical staff at Terrebonne General Medical Center.
Okay. And how can one help prevent swimmer's ear?
You need to keep the ear dry. Now, if a swimmer's ear is usually seen in the summer months, there is a prescription of a vinegar, but if you don't want to get to the doctor, you can take an ounce, a whiskey glass, an ounce, fill it with water. Take 10 drops of distilled vinegar that you can buy in any supermarket, put it in, mix it with the water, take a medicine dropper, and fill the entire ear canal with the drops. And then once you're done with that, there is moisture in the ear, so you take a Kleenex, you wind the Kleenex like this, and you take the Kleenex and stick it in the ear, and you wind it down. And they say, oh my goodness, but look at how far down that went. That's the way to prevent, and you put it in the night, every night, if you're swimming, and before and after swimming.
Before and after swimming. Okay, and you do that as opposed to using a Q-tip, which some people sometimes
It says on the Q-tip box, because they've been sued, don't use Q-tips in the ears. I will not go in any, but you don't want to do that.
Yes, sir.
You don't want to do that.
All right. How do I learn more about swimmer's ear if I want to get more information?
We have a telephone communication capability at Terrebonne General, and I think that we have that right on the screen for our community. And just call those numbers, and they'll get you. We have a nice core of ear, nose, and throat doctors that are on the active and other categories of medical staff at Terrebonne General Medical Center, and I am sure that their officers will be pleased and privileged to take care of the patient.
Dr. Blatt, thank you very much for joining us. Very important issue during the summer months.
Thank you.
Yes, sir.
Bye-bye.
All right. With that, and if you want more information, the number that was on your screen, 873-4141, or you can visit TGMC online at www.tgmc.com. With that, that wraps up our 2-year health segment with Terrebonne General Medical Center. We'll take a short break, and when we come back, we'll turn over to our Nicholls State University segment. That's all next on Bayou Time.